Hi, I'm Martha. I'm Dr. Swann's nurse, and today I'm going to discuss a cervical fusion with you. You will be given a handout, a blue handout that's 4 pages long, and a lot of the information I'm going to give you, you can refer to this later on if you have any more questions. A cervical fusion is done, and this is a model of it that I'm going to explain to you. Today you're seeing a neurosurgeon because you have a disc herniation, spondylosis, stenosis, there's lots of radiculopathy, there's lots of different diagnoses, but it means that you've got pressure on the nerve roots that is causing pain in your neck, arms, and shoulders. When we do this surgery, this is done under general anesthesia, and an incision in the front of your neck is made, and this way we can come to it at an angle and we can remove the bad disc, and the doctor can look through the vertebrae after this disc is removed to make sure all the pressure is off the nerves. The disc is replaced with a cage or a spacer, and I have a little example of that here, and there's also one in between this vertebrae. The spacer is hollow, and they take some bone from the bone bank, and they take some bone also from your vertebrae, some bone marrow, and this is mixed together, and this mixture is put in the middle of the cage. Over a period of about 5 to 6 months, your bone marrow will continue to mix with that bone mixture, and that is what the fusion is. A plate is then placed over top to hold this still while the fusion's taken place. The plate is not removed later on. This full process of healing can take anywhere from 6 months to a year. You'll be encouraged to take a calcium supplement after the surgery, and you may be prescribed a bone growth stimulator to assist in the fusion process. You'll also be given a couple of neck braces to wear for approximately 2 months. You'll have a soft cervical collar that you can wear while you're sleeping, eating, and resting, and then one of the harder collars that'll Velcro on that you'll wear anytime you're up walking around, especially when you're outside. You'll be in the hospital generally 1 or 2 days. You'll have an incision will be closed with steri strips that will be right over the front of your neck. Usually the incision's about 1.5 inches, and you'll be seen about 2 weeks after surgery to remove the steri strips and to get an x-ray. So please be sure to make an appointment before you leave the hospital. After surgery, you may expect to feel some soreness and possible swelling when you swallow. Soft foods may be necessary for a while until that goes away. You'll also experience some muscle tension to your neck, or especially between the shoulder blades, and this is due to some nerve irritation and inflammation. And the more you rest and take it easy, the faster that can go away. So don't be alarmed if you wake up after surgery and you also have some of the same symptoms you had prior to it. Again, there's some inflammation in the nerve root, and that can take up to 6 months, even to a year, for that to go away. It will go away faster with rest and just giving it some time. Going home, you should wear your hard collar and recline the seat back. And the first 2 weeks, we don't even want you out of the house. We want you to do just a lot of resting, just very short walks around the house. Let's see. On the incision, you will have the little steri strips, and you just need to keep that dry for 5 days. So a bath is okay, and just keeping the neck dry. And then after 5 days, you can take a shower, and the water can run over it. You can wash your hair and just blot it dry gently. When you're at home, usually you'll need a recliner or a wedge, or making a wedge with some pillows, because you're going to be more comfortable in a little bit of an inclined position. An x-ray will be done, again, about 2 weeks after surgery to check the progress of your surgery. There will be no driving for approximately 3 weeks after surgery. Again, refer to your blue handout, and that will give you some more details on the risk, complications, and the operation. Before surgery, it's important to be medically cleared about 2 to 3 weeks prior. You will be given a list of tests that need to be run ahead of time. Your primary physician needs to also examine you and give us a note along with the results that you are cleared for surgery. If you have any medical issues, if you have no medical issues or under 55 years of age, you can have these tests done ahead of time at the hospital you're going to have the surgery at. We will also review the medications that you're taking currently with you. Any medications that can thin the blood, a lot of the over-counter medications like anti-inflammatories, aspirin, Advil, Aleve, Motrin, blood-thinning medications such as Plavix, Coumadin, Agranox, vitamins like vitamin E and fish oil need to be stopped 1 week prior to the surgery. There's some diabetic medications, for example metformin, that need to be stopped 48 hours prior to surgery. Do not stop any of your cardiac or blood pressure medications. In fact, we want you to take them the morning of surgery with a sip of water. You'll need pain medications and muscle relaxants after surgery when you get home. If you have a pain doctor, please discuss this with him because he generally will handle it even after surgery. If you have any medications that need to be refilled that Dr. Swann has prescribed, have the pharmacy call our office and we'll refill them for you as appropriate. If it's been over 6 months since we've seen you, if it's after hours or on the weekends, we do not refill medications. You will be notified once your surgery is scheduled with the date and time. Again, you'll need to fast about 10 hours prior to the surgery, and that includes no water or food. After surgery, a healthy diet is going to be important, and also making sure that you don't get constipated because that's very common after this type of surgery. A laxative, and of course if you can handle it with diet, with fruits and vegetables and fiber, that's all good. If you have any FMLA or disability paperwork that needs to be filled out prior to the surgery, please drop this off, mail it or fax it, and our number's on the card, approximately 1 week prior to when it's due, and there is a fee to fill these out. Again, please refer to your handout if you have any information, if you have any further information. Thank you.